Good afternoon, I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we address problems in the healthcare system and then take action to make a better system for all of us. Before we get started on today's topic, which is cancer in rural America and in medical deserts, down below in the YouTube description box, you'll find a link to the Healthcare Advocacy newsletter that is the text for today's video. You can go to that newsletter and sign up and receive those newsletters daily in your inbox. So let's get started. Hospitals and other medical facilities are at severe risk in rural America. According to a University of North Carolina study, 195 rural hospitals have closed or converted to emergency-only care since 2005. The Center for Healthcare Quality and Payment Reform, I know that's a mouthful, but that's actually a U.S. government agency. They reported that more than 700 rural hospitals are currently at risk of closure in the U.S. That's 30% of all rural hospitals in the United States. And of those, 360, a little more than half, are at immediate risk of closure. Now, for rural patients, getting cancer treatment close to home has always been hard. But in recent years, chemotherapy deserts have expanded across the United States, with 382 rural hospitals halting the service between 2014 and 2022. That's according to a report published this year by Chartis, which is a health analytics and consulting firm. It's worth noting that those facilities also treat many patients who have many other illnesses that require infusion. They're often blood-borne illnesses, sometimes autoimmune problems or lupus, and all those patients are now at higher risk. Anyway, Texas, big surprise, leads the list. 57 rural hospitals, nearly half of those statewide, that did offer chemotherapy, cutting services by 2022, according to that same analysis. Rural hospitals in states like Texas, which have not expanded Medicaid, have been more likely to close, according to data from the Cecil G. Shep Center for Health Services Research. Now, to keep the doors open, financially strapped facilities in small communities nationwide continue to shed basic services like obstetrics and chemotherapy. Loss of chemotherapy services can signal other gaps in cancer care, like a shortage of local specialty physicians and nurses, which is bad news for patients. This according to Marquita Lewis-Thames, who's an assistant professor at Northwestern University in Chicago, in downtown Chicago, and her specialty is rural cancer care. Anyway, rural patients are less likely to survive at least 5 years after a cancer diagnosis compared with urban counterparts. This was a study co-authored by Lewis-Thames, and it was published in the Journal of the American Medical Association Network Open in 2022. There's a link to it, of course, in the newsletter. While the rural-urban survival gap has narrowed over nearly 40 years that researchers looked at it, the disparity persists across all racial and ethnic groups, with very few exceptions. Now, many cancer drugs are now given orally, so that's good, and they can be taken at home. But some treatments for breast cancer, colon cancer, other common cancers, as I mentioned, even lupus and other autoimmune diseases, have to be administered intravenously inside a medical facility. And even the distances of an hour or two each way can really strain patients who are already coping with nausea, diarrhea, and many other side effects, which can be debilitating. Anyway, if you want to read more about it, there's a Kaiser Family Foundation report, and their link is in the newsletter. Look, what's really needed is more care in rural areas. Here's an idea to do it. What if there were a way to make sure that medical shortages were addressed by keeping facilities open? If there were a plan to make sure that basic infrastructure costs of these facilities and labor were covered so that the services could be available to rural communities, that would be a big help. Well, I'm going to tell you, go look at section 611 called Payments to Institutional Providers Based on Global Budgets. It's a section of House Resolution 3421, the Improved Medicare for All Act of 2023. It identifies how infrastructure costs would be covered. Then flip over to section 403, Regional Administration, to discover that the regional administrators can identify shortages in their region, like insufficient cancer treatment, and have the ability to make sure that facilities can care for patients correctly using the methods identified in the special projects section. Anyway, if you go to the newsletter, there is a link to the text at congress.gov. My own member of Congress in Congressional District 3 in Washington, it's Marie Gluesenkamp-Perez, and my senators all shy away from such a design system, and they favor Band-Aid approaches like many of your representatives do, because it's easier to do and quicker. But it's time to fix what's broken, because those Band-Aids, they're just like putting a finger in the dike and the leak springs out somewhere else. The current system allows way too many people to suffer, and as we've seen, die needlessly and way too soon. So let's take an action to help repair this. Let's let our representatives in Washington know that people in rural areas do not have the same access to cancer treatment as those in urban areas, and they die sooner. And as a result of that discrepancy, they are put at a huge disadvantage. Universal health care has the ability to build back the healthcare infrastructure so desperately needed in rural communities and in medical deserts all over the country. You can reach them. I'll put the link in the YouTube description box, but I'll read it to you at www.usa.gov/elected-officials. It'll tell you how to get in touch with them. Or use my favorite method, ResistBot. On your cell phone, you send a text message to 50409. Here's the message. Sign, S-I-G-N, space, P-L-Q-T-A-A. So that's sign, P-L-Q-T-A-A. And here's the email you'll send them. I'm your constituent, and I want you to know that there are so many rural hospital closures and so many medical facilities no longer offering cancer treatment or infusions in rural areas that it presents a health risk and a danger to rural Americans. Many have to spend all day driving to and from treatment, and worse yet, their 5-year survival rate is lower than their urban counterparts because of this disparity. You and your legislative staff can read all about it in this Kaiser Family Foundation report, and I include the link in the email for them so they can do some homework. We all deserve to be able to access effective treatment, and that's where you can help, my representatives. I want you to examine H.R. 3421, the Improved Medicare for All Act. Here's the text for you. Link to the text at congress.gov. Specifically, check how global budgets cover infrastructure costs so cancer treatment centers can stay open. Examine how the regional administrators can determine if there are shortages and people in their area are not getting the care they need. Then examine how the special projects section lets them build up those functions as needed, especially in rural areas and medical deserts, to make sure people get the care they deserve. I want you to actively support universal health care like H.R. 3421, a system designed to address every American's access to health care, urban, rural, cradle to grave. Without doing it, without universal health care, you're condemning those people in medical deserts and rural communities to suffer needlessly. I fully expect you to take action and get this to a vote. Thank you. That's what I've got for you. Down below, you can like, share, subscribe, so you get these all the time. You can also send comments to me in the YouTube comment area, or send them to Healthcare Advocacy 1, all one word, @gmail.com. That's it. We'll talk later. Have a good day.